have you here today to share her views and answer some of the frequently asked questions about dentistry. If you have any questions, please post in the chat section below, and we will answer as many questions as possible. It would be great if you could keep your video off and be on mute so we can have a smooth conversation. Our series today is broken down into two sections. The first one, we will be talking about how to handle dental pain. And the second will be, we'll focus on the frequently asked questions by our patients. So without further ado, let's start with our first question.
Just before you start, Dr. Kahini, thank you for having me. It's great to see all of you here. And I hope lockdown has been treating everyone well. As we know, Bombay was just announced that lockdown's extended for another month here. So we're in lockdown till the 31st of July in Mumbai. So that's obviously going to have a lot of impact on our day-to-day routine and of course dentistry, but we're going to talk about that now.
Okay, so our first question, what states as a dental emergency treatment, especially in this lockdown for kids and for adults?
Okay, so it's very important to understand, I understand people are not leaving home right now. So going to the dentist, how do you make a decision whether this is an emergency and I need to go to my dentist now or not? My suggestion would be the first thing you do is call your dentist. Don't take that decision on your own. Speak to your dentist about your symptoms. Speak to your dentist whether they deem it as an emergency or not. But in general, a dental emergency generally constitutes severe pain, pain that's not getting better after you've taken a painkiller. This can be tooth pain, nerve pain coming from the need for a root canal. It can also be a broken tooth that has a sharp cusp and it's irritating your gums and your cheek. That because there's a constant insult there, it keeps irritating the area. Also, if you're undergoing orthodontic treatment, if you've got braces or brackets and the wire has come out, that can be poking, and that will also obviously not get better with popping a medicine in. So any form of pain that's not getting better with medicine, uncontrolled bleeding and swelling, whether the swelling is localized or it's generalized, all of these constitute as a dental emergency. Also, if you have kids and they're playing and they fall down and a tooth pops out, this kind of scenario would constitute as a dental emergency.
Speaking of teeth falling out, what should a parent do if a tooth falls out when their child is playing?
And you're at home, you're in lockdown. So the first thing is, and it's very hard for a parent to do this, and I know this because I am a parent, don't panic, okay? It can get fixed. What you need to do is, of course, contact your dentist immediately because time is of the essence. How the future of that tooth, generally the tooth can get reimplanted back in the socket, but whether it can or not successfully depends on two things. One, how quickly you get that tooth and your patient to the dentist. And secondly, how you handle it. So step one, you see a tooth on the ground, you do not pick it up from the root. Okay, if you look at a tooth, you'll see there's a white part of the tooth and there's sort of a little bit more of a yellow part. The yellow part is the crown of the tooth, the root of the tooth, and the white part is the tooth, the crown. Pick up the tooth from the crown. Do not pick it up from the roots because you will end up destroying some of the fibers that are necessary in reimplanting the tooth back. Secondly, our natural reaction, something falls on the ground, is to wash it. Do not wash it. Do not put it under water. The best thing you can do is take a container full of milk, put the tooth in the container of milk, take your child, take that tooth, and go to the dentist as soon as you can. That will give you the best success rate.
And what should you do to stop the bleeding at that time?
Okay, so just step one for parents, remember, little bit of blood, lot of saliva, coupled with lots of tears can seem like a lot of blood. So don't panic, okay? Secondly, wash the area with clean filtered water. Once you wash the whole area with water, you'll be able to see where the bleeding is happening, where the cut is. Then what you need to do is get a bit of ice, wrap it in a clean towel, and use that to compress and press on that area where the bleeding is coming from. Compress it for 20 minutes. It will stop the bleeding. That should be about the right amount of time for you to get to the dentist anyway. So,
okay. Moving on to tooth pain. To relieve tooth pain, does a cold pack work better or a hot pack?
all right, so, both the kinds of packs are good, but you need to just realize, is your pain coming from your tooth or is it coming from muscle? Okay, tooth pain generally means it's kind of like a nerve pain. So if you have a lot of sensitivity to hot or cold or even sweets, it's coming from your tooth. In that scenario, a cold pack works great. So again, the best cold pack people have at home is ice in your fridge. Wrap it in a clean towel. Wherever your tooth pain's coming from, you can place the towel on that area and it should give you some temporary relief. Heat packs work very well when you have the pain coming from muscles. So if you have a stiffness of the neck or jaw stiffness because you've been grinding, and we'll talk about grinding soon, in that case, heat packs work better.
Why do people have sensitive teeth and what does that indicate?
Okay, this is a big topic, so we'll break it down. Sensitive teeth can be, you can have generalized sensitivity or localized sensitivity. If you have generalized sensitivity, as in you wake up in the morning and all your teeth feel sensitive for the first few minutes or half an hour, that there's a strong indication that if that's the case, it means you've been grinding your teeth at night. While you're sleeping, you're grinding, you're bringing your teeth together and pressing them against each other. Okay, so that's when you have generalized sensitivity. If you have sensitivity to cold foods in one certain area, it could be because you brushed too hard. More often than not, it's because of a condition called recession. Now, gum recession. Gum recession happens because you brush that area too hard and your gum shrinks away from the tooth, okay? Generally, our tooth, the lower part of our tooth is covered by gum. If we brush too hard, that gum shrinks away. So it's like, the tooth now feels very cold because it's used to being covered by that blanket of gum. So it's highly sensitive. Now, of course, the other reason you can have sensitivity is because you have a cavity. Okay, so the reason for the sensitivity has to be figured out first before you can go ahead and treat for the sensitivity.
Okay, and there's a follow-up question on that. How can the sensitivity be managed?
Okay, so like I said, let's first figure out the reason. If your sensitivity is coming from grinding, then your dentist has to diagnose that and fix that. And I think we'll talk about that later. If the sensitivity is generalized, okay, there's a couple of things you can do. The first thing is you need to stop brushing hard, okay? If it's because of gum recession, it's in a certain area, you need to use a soft toothbrush. You need to not scrub your teeth. Scrubbing your teeth destroys gum. The bad thing about gum is once it's gone, it's destroyed, it never grows back. Okay, so you need to use an extra soft or a soft toothbrush. You should also never scrub your gum. Your teeth should always be brushed in a circular round motion, gently. That way you find that you are cleaning your teeth well, but at the same time, you're not hurting your gums. All right. Also, if you have generalized sensitivity in an area and you feel it's coming from recession, a good thing is to use some over-the-counter toothpaste initially. You can try to use Sensodyne toothpaste, which is made by Oral-B, or you can even use Colgate-sensitive toothpaste. These help desensitize your teeth. I want to talk a little bit about how they desensitize. So your teeth basically have microscopic tubules, little tubes that we can't see. Okay, on one end of the tube is your nerve endings, and on the other end of the tubes, there's these plugs. Now, when you brush too hard, those plugs get removed. And so air and cold water can now go straight in through the tubes and affect your nerve endings. That's why you feel sensitive. So what Colgate Sensitive and Sensodyne toothpaste have are chemicals that go and block those tubes, and they desensitize, so you don't feel the cold as much. We don't want you using these toothpastes for too long. They are safe, but ideally use it for a week to 2 weeks or until your sensitivity goes away, or use it till the whole tube of toothpaste finishes. But then I recommend going back to your normal toothpaste. Of course, if you've tried these things and your sensitivity is not getting better, you need to see your dentist. Perhaps there's another reason for your sensitivity, or you probably need a desensitizing agent that's really strong, which is only present with your dentist, not in the toothpaste. So prolonged sensitivity, do see your dentist. If you know that you're feeling sensitivity in a particular area because food is getting trapped, most probably you have a cavity for which your dentist needs to see you and do a filling. Okay, I hope that answers your question, Dr. Gareema.
Yes, absolutely. Thank you. Speaking of grinding, why do adults and kids grind their teeth?
All right, so clenching or grinding is commonly known as bruxism. It's more common than we would think. Many kids and adults do grind their teeth. This can happen because of stress. It can be a habit. Sometimes it's even genetic. New research has been coming out which shows that people could be grinding their teeth because of a constriction in their airways. Okay, so that can lead to clenching or grinding at night, sometimes even during the daytime. So there are ways to correct this grinding, but first you need to determine why are you grinding? And that can be done by your dentist. But the good thing to know is that it is treatable. The important thing to know is it is not normal, okay? Your teeth should be far apart at rest. There should be a little bit of a gap between your teeth at rest. That is the normal stage of your teeth. If your teeth during sleep or in the daytime, you find yourself that you are clenching them together or that you are rubbing them against each other, that is not normal, and you do need to seek some dental advice for that.
Okay, and how will a person know that they are grinding their teeth at night?
Okay, so a big symptom of grinding is that you wake up in the morning and you feel like your jaw is sort of stuck together, your teeth are stuck together, okay, temporarily, and you need to kind of loosen your jaw by moving it around like this. Okay, that kind of feeling when you wake up is a big indication that you've been clenching or grinding your teeth at night. Mm-hmm. Also, you can wake up in the mornings and you feel a stiffness around your jaw, your neck, tightness, stiffness, sometimes even regular headaches can be a sign that you're grinding your teeth at night. Mm-hmm. Treatment for grinding? Yes,
that was my next
one. As we say, first of all, we need to determine why are you grinding. If your grinding is related to a constriction in your airways, then of course it needs a different pathway of treatment. But if your dentist diagnoses it as a habit or due to stress, then of course, step one, you and your dentist need to have a discussion on how can you alleviate your stress. Blue light, being on the computer, being on your phone before you go to bed. It makes you go to bed not with a relaxed, calm mind. So people who have a habit of grinding at night, this will exacerbate their grinding. If you are stressed, of course, that exacerbates it. So sometimes it's just hard, it's very easy for us to say, reduce your stress, but that's not really under our control all the time. So in that case, we need to make sure, as dentists, I will build a mouth guard for my patients. which they can wear when they sleep. It's called a night splint. And in that case, when you're grinding, you're actually grinding not your teeth together, but really you're grinding that mouth guard. So your teeth remain protected. One of the biggest side effects of grinding, other than jaw and tooth pain, is cracks that appear in your teeth. Okay, grinding over time weakens our teeth. So we need to protect it with a mouth guard. Another symptom, just coming back to your previous question about grinding, how will a patient know? You know, if you're constantly breaking your fillings, if you're constantly chipping your teeth, that's a sign that you're probably grinding at night. So give your dentist a call and talk about these things with them.
Okay, thank you for that.
Yeah, no worries.
Is there a correlation between a headache and tooth problems?
Yes, definitely. So I'm going to answer this question twofold. Firstly, nerves, okay? The nerves that innervate our teeth also innervate, you know, our eyes, our head. All the nerves of the upper part of our body are connected. So it's very common for tooth pain to refer as headaches, even earaches, okay? Mm-hmm. Similarly, muscles. Our muscles are all interconnected. In our face, our eating muscles, our chewing muscles, our talking muscles, even our neck and back muscles, they're all connected. So if you are grinding, like I said, it can present as jaw pain, but it can also refer as headaches. Migraines, if you constantly get migraines, you know, the number of patients I see who are being treated for migraines, but the root cause is actually teeth grinding. So it's a clear referral pain. Also, eye pain and any upper back pain can also be as a result of tooth grinding because your muscles are interconnected as well as your nerves.
What kind of food should you avoid if you have a tooth problem?
Okay, so again, your tooth pain, you're the best judge, okay? If you feel that I have a toothache and this is getting exacerbated or getting worse because I'm having hot or cold, avoid that. Hot foods, cold foods can cause, make teeth pain get worse. If you've got ulcers, you'll find that they generally get exacerbated by spicy foods. So avoid that. If you find that you've got jaw pain, which is probably coming from grinding and clenching, then you need to probably avoid temporarily foods that are hard, nuts, crunchy foods, because they will require your jaw to work hard. So you need to avoid foods according to whatever is exacerbating the pain. But of course, just avoiding the foods is not the right way to go. You do need to contact your dentist as well to find out the cause of the pain. But temporarily, hot foods, cold foods, extremely sweet foods if you have a cavity, spicy foods, and hard foods. I think I've covered all foods pretty much, but figure out which one it is and avoid that for the time being.
Okay. And there is a condition called oral sleep apnea.
Yeah.
Can you tell us a little bit about that?
Yes. So oral sleep apnea is a condition where when a person is sleeping, temporarily they stop breathing. They have short lapses where they stop breathing. Now, this is a very dangerous condition because it not only can affect our health, our heart, our breathing, but it can also have long-term effects on our mortality, okay? Because you are stopping breathing temporarily. So it is a condition that needs attention, okay? How can you know, it's very hard to know whether you have sleep apnea. It needs to be diagnosed properly. It needs to be diagnosed by your dentist or your ENT. They need to do a sleep study to completely diagnose whether you suffer from sleep apnea. But certain signs and symptoms that point towards the fact that you may have sleep apnea are the fact that you've slept well. You've slept your 8 to 10 hours at night, but you wake up feeling exhausted. You feel like you haven't slept at night. And this is primarily because you keep having these episodes where you stop breathing. So it taxes your body, okay? So you wake up feeling exhausted. You're exhausted in the afternoons, even though you've had a good night's sleep. That's a sign that you may have sleep apnea. Another common sign for sleep apnea is snoring. Now, people generally think, oh, if he's snoring, he's sleeping very nicely, he's having a good night's sleep. And that may well be the case. But another symptom, like I said, of sleep apnea is that you snore. So if you are snoring, people who are overweight tend to suffer from sleep apnea, because when you are overweight, you've got more fat tissue around your cheeks and your tongue. So when you're sleeping, all of this flops back and can constrict your airways and stop you breathing temporarily at night. So clenching and grinding is also an indication of sleep apnea. So all these reasons can point towards sleep apnea. If you find that you have one or two more of these symptoms, do talk to your dentist, because sleep apnea, like I said, is a serious condition. At best, your dentist will ask you a few questions, get you to fill in a questionnaire, and then come back and say, no, you don't suffer from sleep apnea. But if you do, it's a good idea to get it treated. Now, most people will be thinking, well, this is a sleep disorder. Why should I contact my dentist for it? But the reason for this is mild to moderate cases of sleep apnea can easily be treated by your dentist. Your dentist can make a device that you wear when you sleep, which basically brings your jaw forward and allows your airways to remain open at night. And so you can breathe well and sleep well. Okay? When you have severe cases of sleep apnea, you need to use a CPAP machine. Now, I see many patients with sleep apnea who have mild cases using a CPAP machine. If you know anything about a CPAP machine, you'll know it's very difficult to sleep with one. It's also very difficult for your partner to sleep with a CPAP machine when you're using one, because it's loud, it's bulky. It's almost like a truck is running through the room. That's how loud they are. So talk to your dentist. If you do have a mild to moderate case of sleep apnea, it can be treated by your dentist in a very simple way.
Okay, thank you for this. This sums up our questions on dental pain. Do you have any other points that you would like to add to this?
Yeah, look, if you have dental pain during lockdown, call your dentist. Okay, I understand nobody wants to expose themselves to a dentist, and your dentist will want to do the same. They don't want to expose themselves either. So the best thing is speak to your dentist, have a virtual consultation. It's a virtual world these days. I'm doing a lot of consults on Skype, on WhatsApp video. So speak to your dentist, show them what the problem is. And if they feel it's necessary, only then will they call you into the clinic. Let your dentist diagnose this, don't you decide, oh, this is not an emergency, because it may not seem an emergency right now, but it may become an emergency if you leave it for too long.
Yeah, absolutely.
Yeah.
Okay, so now we will move on to our second section. So that will be answering a couple of FAQs.
Yeah, go ahead.
Okay, the first one is, what age should a child visit their dentist for his first appointment?
Okay, so the recommendation by the Pediatric Dental Association worldwide is that you should take your child for their first dental appointment at age 1. Now, okay, I'm sure many of you are thinking, isn't that too early? But it's not. By age 1, a child has a few of their front teeth. This is a great time to go see your dentist, because they will be able to assess, are you able to keep your child's teeth clean well? Does your child have any signs of the cavity forming? So even before it's become a hole, at that stage, it can still be reversible. So it's a great time to take your child when they're that old. Also, other than cleaning and diagnosing cavities, it's great to take your child early on, because there's a general fear kids develop of the dentist, okay? And that's because they go to the dentist when they're already quite old. So take them, make dental appointments fun. Obviously not right now, not during lockdown, but when things get back to normal, start taking your child to dental appointments from age 1. You should take your child every 6 months. And the reason for this is because cavities in kids form a lot faster and progress a lot faster than in adults. The main reason being kids' teeth are very soft, much more soft because they have a higher organic component than adult teeth. So you need to keep an eye on it. So 6 monthly checkups for your child become imperative. While I'm saying this, during the 6 months, do keep an eye on your kids' teeth as well. If you notice black or brown or even gray, green spots, call your dentist because it could be signs of a cavity forming and you don't want to leave it for too long.
Okay. So you mentioned 6 monthly visits for children, but what about adults? How often do you think they should visit dentists?
Okay, so me as a dentist, what I do is I grade my patients into high risk and low risk patients. Okay, low decay risk and high decay risk. If they are high decay risk, which is generally indicated by the cleaning's not so great, or they come up with fillings that need to be redone, or new holes are popping up often, then I categorize them as high risk, in which case I like to see my patients every 3 to 6 months. That way, if a new cavity is forming, I picked it up soon, not before it needs a root canal treatment. Okay?
Okay.
If they are low risk, which means they clean their teeth well, they don't have many holes, you know, they don't come often with new holes for me to fit. In that case, I will categorize them as low risk, in which case I'm happy to see them every 6 to 12 months. So the range changes from about 3 months to a year, depending on your risk level. But as a thumb rule, every 6 months, go see your dentist.
Okay. And how often should they visit a dental clinic for a cleanup?
Again, it comes down to how their cleaning is and how much tartar buildup are they getting. Now, how much tartar buildup is a result of how efficiently can they clean their teeth, and of course, how much saliva do they make? Because saliva has calcium and phosphate, which is required to build tartar. So while saliva can be protective, unfortunately, it also forms tartar. So if you're not able to keep your teeth very clean, and that could just be because the fact that your teeth are very crowded and you know they've got these nooks and corners that you can't clean, then you may find that you need to get your teeth cleaned by a dentist. You need more help, in which case you might end up seeing your dentist every 3 to 6 months for a clean. If you've got perfectly straight teeth, you're able to brush well, you're able to floss. Now, flossing becomes very important in cleaning teeth because no matter how well you brush your teeth, you cannot clean your teeth in between your teeth with a brush. So for that, you must be using a floss. If you don't floss, you're not able to keep your teeth very clean, you have crooked teeth, you might need to visit your dentist for cleans more often. But again, as a thumb rule, I like to see my patients every 6 months for a clean.
And is there any way to prevent this tartar formation?
Prevention is, again, a result of good cleaning. Everybody will form a little bit of tartar. Just to tell you what is tartar. Tartar is basically plaque that has formed on your teeth, but that plaque has stayed on your teeth for a long time. And the minerals from your saliva, like calcium and phosphate, have made it become hard. Unfortunately, once plaque has converted into tartar, it's very hard to clean it off with your toothbrush. Once it's become tartar, you probably need to see your dentist for a clean because they use instruments which are strong enough to get rid of the tartar.
Okay. And there's a question about braces. Is there a right age for braces?
Your orthodontist for your child, I'm assuming you're asking about a child?
Yeah, for your child and for adults.
Okay, so for kids, we generally recommend going to your orthodontist for a consult around age 7 to 8. Now, it might be that your orthodontist says, this is too early, I want to see them back at age 9 or 10. But it's best to go for the first consult around 7 to 8 because sometimes your orthodontic treatment may require expansion of your jaw, may require you to tap into that developmental growth spurt of the child. So you don't want to go to your orthodontist after your child has had their growth spurt, in case they wanted to use the growth spurt as their advantage. So first consult 7 to 8, and then your orthodontist will tell you when to come back. You asked about adults. So yep, it's not just kids who want straight teeth. Adults want straight teeth too. And you'll be happy to know that teeth can be moved and straightened even when you are an adult. Of course, it's easier to align teeth when you're kids, because when you're a child, everything is in movement and is in flux. But even when you are an adult, teeth can be moved. There are traditional braces that we can use to fix your teeth and align them, but there are also clear aligners, some things like invisible braces, which you can use to align your teeth as well. So there are options for adults as well.
Okay. Next question is, why do I bleed when I brush my teeth? What can we do to prevent that?
Oh, these are big questions. Okay. So an important thing to know is I always get patients coming in and saying, my teeth are bleeding. It's not your teeth that are bleeding. It's actually the blood is coming from your gums. Okay. Generally, bleeding can be a sign of, more commonly than not, it's a sign of gum disease, which is called, a milder version of gum disease is called gingivitis. And the reason gingivitis happens is because your gums are inflamed. They're inflamed because you have plaque forming at that junction where the gum, the pink part of your tooth, meets the white part of your tooth. That pink to white junction loves trapping plaque. Okay, plaque loves to sit at that junction. So if when you're brushing your teeth, you haven't been able to clean that junction well, which is a common thing I see in my patients, because people think I just need to brush my teeth. Yes, you need to brush your teeth. We all want white teeth, but you actually need to take that brush a little bit higher for your top teeth and a little bit lower for your bottom teeth, because you need to brush that junction. If plaque accumulates there and stays there for a long time, it will inflame your gums. And so when you brush, you'll bleed. Now, you asked about how do we fix this? First thing is, don't panic, okay? If you're bleeding when you're brushing and you're spitting out blood, most of my patients say, I brushed around this side, I spat, there was blood, so I don't brush that side anymore, okay? That's the worst thing you can do. If you find you're bleeding from an area where you're brushing, you must clean that area, because remember, I just explained, you're bleeding because you've got plaque there. If you don't remove that plaque, the bleeding will not stop because your gum will remain inflamed. So the important thing is not to brush hard. Gentle circular motions around that gum and tooth junction with a soft brush is the best way. Brush like that gently, continue. In 3 or 4 days, you should see an improvement. There should be no blood when you're spitting out. If after 10 days to 2 weeks, you don't see an improvement and you're spitting out blood, you need to see your dentist, okay? It could be that you may think you're brushing in the correct way, but you're not. So your dentist can help identify that. Or it could be that, you know, you have some systemic reasons like anemia, which is causing bleeding when you're spitting. So then you do need to contact your dentist.
Okay. And what works better, since we're talking about brushing, in electronic toothbrush or manual brushing?
So research has shown that they're both equal. One is not more superior than the other. If you're brushing with the correct technique, then your brushing will be as effective as an electric toothbrush. Okay. So electric toothbrushes are warranted if you want to use that, or if you have dexterity issues. Okay. But if brushed properly, both are just as good.
Okay. And why do, there's a question on staining teeth. Why do my teeth get stained?
Okay. So if you're a smoker, you already know why your teeth get stained. The nicotine loves to hold on to teeth. So if you're a smoker or a tobacco chewer, you know that your stains are coming because of that. But you'll be surprised to know lots of foods and drinks can also cause staining, and they can present as brown stains or overall a dullness, a yellowness of teeth. So some common foods and drinks are tea and coffee. Tea and coffee contain tannins, which can leave brown stains on our teeth. There's been these recent studies which have shown that if you up the milk content on your tea and coffee, then the stains decrease. So if you love your tea and coffee, but you're sick of having stains, you might want to try some extra milk in your tea and coffee. Other reasons foods that stain your teeth are curries, which have a lot of turmeric in it, colas, fruit juices, beetroot, fresh berries, balsamic vinegar. These are all foods and drinks that stain your teeth. Another one I missed is red wine. Red wine leaves a lot of stain. I just want to point out here that yes, your teeth will stain with foods and drinks and over time, with these colored foods. But also just be aware, as you get older, your teeth do change color. They become from more white to yellow. Now that's a natural aging process, in which case your enamel, which is the top layer of your tooth, becomes thinner, and the yellower part, which is the inside dentine layer, starts to show more. In that case, you might find that cleans don't help with whitening so much, and you might actually need to have a whitening treatment done.
Okay. And talking about whitening teeth, is there a way to whiten teeth at home?
So you do, if you go to your chemist, there are many whitening over-the-counter agents that people say you can use. As a dentist, I don't advocate them, because many whitening agents can whiten your teeth by abrading them, by removing the top layer. Sometimes the concentration of whitening agents is very different in over-the-counter products, which can lead to extreme sensitivity on teeth. If you've ever had whitening, you'll know that you get trays made to fit your mouth that in which you can put your bleaching agent to whiten your teeth. Now, if these trays are bought over the counter, they are not custom made. They don't fit your teeth perfectly, in which case when you're whitening, you'll get leakage of the whitening agent, and it can cause your gums to burn. So if you really want your teeth whitened, see your dentist. It's the best and safest way to whiten your teeth. Whitening's great when done properly. It doesn't harm your teeth. The harm comes from over-the-counter products.
Okay. I've got this question a lot of times. If you have a sweet tooth, what can be done to reduce the chances of a cavity?
Well, as you know, sweet tooth, sugars are the biggest culprit in causing cavities. So the first thing is reduce the intake of sugars. Now, sugars does not mean just lollies. You'll be surprised to find hidden sugars in breads, pizzas, fruits even, okay? So these all contain sugars. What happens is if the sugars or foods stay on our teeth for too long, the bacteria that are present in our mouth attack these sugars and then metabolize them, creating something called lactic acid. Lactic acid is a very powerful and strong acid, and it actually starts to dissolve the mineral in your teeth, leading to cavities. So step one, reduce your sugar intake. Okay, but the question was, if I want to have sugars, how can I reduce their effects and reduce my chances of getting decay? So step two, if you've eaten something sweet, try to brush it if you can. If you're at home, brush it off. That's the best way. If the food's not stuck to your tooth, it won't lead to decay. Another thing you can do that's important is the time you eat the sweet food, okay? Now, the worst thing you can do is have the sweet food as a snack, because at that point you have the least saliva in your mouth. You know, between my lunch and dinner, I decide to have a sweet. I don't have much saliva in my mouth. So the protective effects from my saliva are not present as much. So the best times to eat sweet is straight after your lunch or straight after your dinner. You've had your lunch, you've been chewing for 20 minutes, you've made a lot of saliva. So that cleansing effect of the saliva will wash away the sweet as well. So as a general thumb rule, if you have a sweet tooth, have that sweet, that little dessert, straight after you've had your big meal, your lunch or dinner. Avoid having sweets as a snack. Also, the form of sweet you have is very important. Okay? If you have sweet cravings, I prefer you have sweet in solution, like, lemon water with sugar in it. Because the sweet drink goes straight to the back of your throat and it doesn't stay contacting your tooth as long. Whereas if you have something like a toffee or a lolly, which gets stuck in the grooves of your teeth and they stay there for a long time, that will obviously lead to decay. So if you have sweet cravings and you must have something, have it more often than not in a solution form and also with your big meals.
Okay. We have some questions on kids. Are baby teeth important?
Yes, I see many patients who bring their kids in and they feel like, oh, this is a baby tooth, it's going to fall out. So it's okay. It's not okay. Okay. The reason for that is like we discussed earlier, kids' teeth are soft. If a cavity is forming, it grows very quickly compared to an adult. So it can straight away, if neglected, go and affect the nerve, and it can result in abscesses and extreme tooth pain. Okay? Tooth pain, if your child has tooth pain, your child's not going to eat well. Their nutrition will get affected. In turn, their growth gets affected. Okay? If the cavity has reached their nerve, an abscess can form, which can affect the tooth, the adult tooth that is developing at the top. Okay, so you have a baby tooth, and on top of the baby tooth, under the gum, is the adult tooth forming. So it's very important to look after your baby teeth. Another reason is if you get an abscess or you get a big cavity and your dentist decides to take that tooth out for you. Okay, your adult tooth is only going to come out at the right age. So if you need your baby tooth extracted before its appropriate age when it falls out, this can be a cause of concern because then your other teeth will just tilt and grow into that space. This doesn't leave room for your adult teeth to come into place. And it can lead to crowding, malocclusions. It can lead to your child needing braces for sure. So baby teeth are important, guys. Cleaning them, taking your child to the dentist, it's very important.
Okay. In our chat section, there's a question about baby teeth. Is root canal treatment avoidable for a 4-year-old child?
Oh, that's a tough decision to make. Okay, your tooth needs a root canal treatment because the hole has become too big. Okay, the nerve has gotten infected. If your dentist is saying your child needs a root canal treatment, then you probably do need to do something about it, because if you ignore it, it will probably become an abscess. Okay, and abscesses are dangerous. Like I said, they can affect the development of your adult teeth, but more often than not, abscesses can also lead to facial swelling. So if your dentist has advised a root canal treatment for your 4-year-old child, you need to do something about it. Now, obviously, doing a root canal treatment for a 4-year-old is close to impossible. Your child is not going to stay in your chair, in which case you probably need to get the child under some form of sedation or a general anesthetic and get that looked into. But this situation can be avoided if you start taking your child to the dentist from age 1 and take them every 6 months.
Okay.
Okay.
Yes. What are fissure sealants?
Okay, that's a really good question, guys. Fissure sealants, I highly recommend them for all my child patients. So fissure sealants are a biocompatible filling material that dentists will use. It's kind of like a liquid filling material, and we use it to fill the grooves of your teeth. Okay, so deep grooves trap food. Food stays on your tooth long enough, will lead to cavities. So we use these liquid filling materials to block out the grooves of your child's tooth, and that way food doesn't get trapped. Now, the good thing about fissure sealants is they're completely biocompatible, they're completely safe, and they are done painlessly. There's no drilling involved. It's just about putting that filling material on your child's tooth grooves and setting it. Many kids also enjoy this. You know, it's a painless procedure and they get involved. So it's a very good way to desensitize your child towards the dentist. But great preventive measure, and you should talk to your dentist about dental sealants.
There's another question on white spots. Are white spots on milk teeth a problem? And what can we do about that?
Okay, so white spots can be for two reasons. One, it's a sign of hypercalcification. These are developmental white spots that are inherent in your tooth, and they probably formed during when your child's tooth was developing, which for baby teeth is when the mother is carrying the child. So if the mother was temporarily sick or the mother took some medicine, these can lead to some of these white spots. Good thing to know is that these white spots are completely safe and they don't really need any treatment other than keeping that area extremely clean. All right, but however, you can get white spots also forming as a sign of initial decay. Okay, when teeth start to get form decay, they don't suddenly become a hole. They start to lose minerals slowly. As teeth lose minerals slowly, they can appear as white spots. So do take your child to the dentist to find out what the white spots are. If they're a developmental issue, then that's fine. But if it is because of decay that's starting, then it needs attention.
Okay. And there's one more about, is there any information that you can give us about age-appropriate toothpaste? What can be used for a child and what adults or senior people can use?
Okay, so yes, there are age-specific toothpastes. So from the age of 0 to 2, because your child cannot spit, you should use toothpastes that contain no fluoride, okay, because you don't want your child ingesting the fluoride. From age 2 to 6, and for some people it might be 2, but for others it might be 2.5, 3 years of age. But basically from the age your child can spit out, you need to start using a toothpaste that has a low dose of fluoride in it. So somewhere from 500 to 700 ppm of fluoride. That's what we recommend for kids. Once your child is 6 years of age and they start getting their adult teeth forming and coming out, and also they can clearly spit out very well, you can move to an adult toothpaste, which contains 1,000 to 1,500 ppm of fluoride. Okay, now I just want to talk a little bit about fluoride. Clearly, as you can see, fluoride is very important. And that's because fluoride helps form a strong, hard layer on the outside surface of your tooth, which is resistant to decay. So it's very good to have fluoride, but you must not ingest the fluoride, which is why we move from no fluoride to low fluoride to the desired fluoride content.
Okay. We are getting a lot of questions on bad breath. So I'm just going to summarize all of them. There are questions about bad breath at different ages. So for bad breath in the morning at a younger age, or bad breath for an older age.
Yeah. Okay. So let's just talk about bad breath first.
Yeah.
More often than not, bad breath is a result of poor cleaning. Okay. So if you have a lot of plaque sitting on your teeth, that can of course lead to bad breath because you're not able to remove the plaque and the food particles. Common reason for bad breath is lack of flossing, because even though your teeth seem like they don't have any food stuck on it, they may be stuck in between your teeth. Bad breath is also caused because people don't clean their tongue. So food particles and bacteria go and get trapped on the surface of your tongue. So you can use the back of your toothbrush, or you can even buy a tongue cleaner, but clean your teeth and your tongue, and you'll find that bad breath will go away. Now, sometimes there's a persistent bad breath, okay, even though you're cleaning well. In older people, I see this because they're on certain medications. Okay, when you're on certain medications, the side effect of these medications is a dry mouth. When you have a dry mouth, you don't get the effects of saliva cleansing as often, in which case, you know, the plaque and the bacteria sit there, so it leads to bad breath. The way you can combat this is to have frequent sips of water to keep that cleansing effect happening. Another reason persistent bad breath can exist is because you have a throat infection or a stomach infection. So you might have to see your GP for that. And lastly, and this is something I see a lot, sinusitis. If patients suffer from sinusitis and they develop a long-term post-nasal drip, so you constantly get a drip from your nose into your mouth, then that can also lead to bad breath. So like I said, more often than not, because of poor cleaning, if you're brushing, flossing, and cleaning your tongue and it's still not going away, talk to your dentist, who may then refer you to your GP.
Okay, and do you recommend mouthwashes?
Okay, so mouthwashes are good. If you want to use mouthwashes, go for it. But do not think that mouthwashes are a replacement for brushing or flossing. So just so you know the importance of mouthwash, I don't use mouthwash, okay? I brush my teeth and I floss my teeth, and that's enough to keep my teeth healthy. A mouthwash can be an adjunct to brushing and flossing, but it most definitely is not a replacement. I find my patients like to use mouthwash because it gives them a feeling of freshness, of breath, and just makes them feel good, in which case please go ahead and use a mouthwash. My only request is make sure you look at the back, the content, the ingredients of the mouthwash, and make sure that your mouthwash does not contain alcohol. You do not want to be rinsing your mouth out with alcohol every morning. So use an alcohol-free mouthwash and you're fine.
Okay. There are a couple of questions on wisdom teeth.
Okay.
Do you need wisdom teeth extracted? What if you have pain in the wisdom tooth and it's just getting worse?
Yeah, you always hear these horror stories about wisdom teeth extractions. Okay, let's just start a little bit at the back. Why do we need our wisdom teeth extracted? This is related to evolution. Okay, as evolution has progressed, our diet has become softer. We're eating more processed foods, which means that overall we don't chew as hard of foods, so our jaw does not need to be as big and strong. So our jaw over time, as we've evolved, has become smaller. As our jaw has become smaller, it cannot accommodate all our teeth, okay? Wisdom teeth are the last teeth to come out. They generally erupt around age 18 to 25. By the time wisdom teeth try to pop out, your other teeth have comfortably seated themselves and they don't leave enough room for your wisdom tooth to come out. So more often than not, your wisdom tooth will try to come out, but because there's no room, it becomes impacted. Only a little bit of it comes out, or it's growing towards your gum or to your cheek or to your tongue. So it gets blocked. Now, when it gets blocked, you're not able to keep it clean. So wisdom teeth extractions are warranted in two situations, and two situations only. When you're not able to keep it clean because it's impacted, you will, of course, get decay on it, but also the gum around that area keeps getting inflamed. If your gum keeps getting inflamed, the only way to treat it is with antibiotics. Now, if that keeps happening every couple of months, you want to avoid that because you don't want to constantly be taking antibiotics. So in that case, your dentist will want wisdom teeth extractions. Another time your dentist might recommend having a wisdom tooth extracted is because it's actually growing at an angle and it's growing into your front teeth. So it's causing damage to the roots or the tooth in front, in which case we would say have it taken out. But you know, sometimes I see wisdom teeth that are happily sitting under the gum and they're not doing anything and they're not disturbing anything, in which case we can say leave it. You don't need it extracted.
Okay. And we are on our last question for today.
Okay.
What causes ulcers? Is that a concern, and how do you treat ulcers?
Okay, so ulcers can crop up in your mouth for many reasons. One of the commonest reasons is trauma. So if you're cheek biting constantly, you'll find you get ulcers on your cheek. Sometimes if your wisdom tooth is erupting at the back, you'll find ulcers around that area. Ulcers can also come because you've got acid reflux. So acidity can lead to small ulcers. There's also a condition called recurrent aphthous stomatitis, which are basically idiopathic ulcers. They will just keep coming over time. Okay, they come and go, they come and go. Now, what do you do about this? So first you need to figure out why are you getting ulcers. If they are just common ulcers that come and go, you need to understand that they do come or they do get exacerbated because of stress. Okay? Now, how do you treat ulcers? Ulcers are self-limiting. There's no real treatment for it. It will go away. Okay? It will go away on its own. So the only time I would treat an ulcer, a common ulcer, is if it is causing pain. If it's causing you pain, you can use warm water with salt in it and rinse your mouth out with it often. That will help alleviate the pain. You can also use some over-the-counter medications such as mucopain, which have surface anesthetic in it. So it just kind of gives a lubricant to that ulcer so that you're not constantly abrading it. Now, like I said, if your ulcer is coming because of cheek biting or some form of trauma, your dentist has to remove that trauma, otherwise your ulcer will keep coming up. If you constantly feel you're getting ulcers, you might want to speak to your dentist or your GP and run a blood test, because there are certain vitamins like vitamin A, vitamin C, and vitamin B12, which are very important. You need proper levels of these vitamins to have a good turnover of the mucosa. The mucosa is the inner lining of our mouth. So if we're deficient in these minerals, you'll find that you tend to get ulcers more often. Something I really want to talk about that people should know, if you do get an ulcer and it hasn't gone away in 2 weeks, see your dentist, okay? It is very important. Any form of ulcer does go away in 2 weeks. If it continues on for more than 2 weeks, there is a more serious reason to this. It might be that it's coming from a tooth that is abscessed. It might be that, you know, your blood levels need to be checked out. So golden thumb rule, if your ulcer lasts more than 2 weeks, see your dentist.
Okay, great. So I think we've covered all the questions today. And thank you so much. This has been a lovely chat.
Okay. Yeah, guys,
please.
I can see in the chat section, there's been a lot of questions that have come through. Like Dr. Kahini said, she's tried to group the questions and hopefully I've been able to answer them all. If not, please do reach out and I'd be happy to answer your questions. It's been great having this chat. I hope you're all a little bit more aware of your teeth now. I'd like to thank the Juhu Gym Club for organizing this, and also Concept Pharmaceuticals for giving me an opportunity to talk on this topic. And be safe, guys. Look after yourself, and hopefully you can visit your dentist very soon for that 6-monthly check and clean, which is probably well overdue now.
Thank you so much. Stay safe.
All right, guys. Thank you so much. Bye.
Bye.